So as we were discussing that these were the key components of claims data, like patient details, diagnosis information, procedure, cost of charge, treatment services, physician details, hospital details. Any questions on this? The key component of claims data, guys? Please answer.
No, sir.
Okay. And as we saw that HIPAA compliant thing, right? Every company has to be HIPAA certified. Uh, that is the policy of the US, which is very very strict, right? If someone is not following that policy, or he or she, that company is not avoiding that, the company can be sued. Even lifetime imprisonment can be done. Again, a recap on the patient providers and payers matrix when we are discussing about the claims data, right? Initially, when we were discussing about the US government ecosystem, we discussed the three P's, right? Which is very important for the healthcare system, like payers, which is the government's employers, individuals, patients, us, right? Consumers who go to the hospitals, who go to the providers, and then providers, the hospital doctors, and the government comes into picture in between, who takes care of like some things like regulation and the reimbursement. So this is a picture, right, which depicts how the process runs, right? Patients, uh, these are the patients, right? So they go to the peers for the uh, taxes on premiums, insurance coverage. They do the negotiations, and then regulations of the government uh, are controlling the peers, right? Because there is a lot of economic burden on the US government right now, so they are trying to see how the economic burden can come down. And then providers like hospital and doctors, which gets the payment from the insurance company. So again, just a recap on the healthcare system. Any one want to? So like the healthcare system, if we see, it is divided into private and government into US. Like in private, it's 67.5%, and in government is 37.5%. Within the private, if we classify the insurance, the employment base is 55.7%. So as we discussed earlier, employment based, right? The insurance given by the employers, right? When they join any of the organization, any of the firm, and the direct purchase. Some of the people like in India also, like they purchase an insurance for themselves, maybe a top up, or if they have not a good insurance amount from the firm they are working, they buy. And then there is a government insurance 37.5%, which is Medicare, Medicaid, and military healthcare. So we have been discussed. So again, why I was recapping things, because claims data we were discussing, and claims data goes to the insurance companies, and so that's why I thought let's have a recap on the insurance thing. So this is general claims generation and the transmission. So generally, healthcare claims get processed into three main phases. First is the service delivery. Information get documented about the services they will delivered, which is like the in the claims form. You document everything, right? About the test, about the treatment, what doctor you met, what were the tests done, what were the reports, what was the first line of therapy, what was the standard of care, and everything. It was there. And then second is the claims generation. Claim generation provide raise the claim on the behalf of the patient. So why behalf of the patient is written there? Sometime patient does, and sometime provider may do this on the behalf of the patient. Like in India also, sometime every big hospital has a the insurance counter which does uh, uh, instead of you, because you are busy in doing other things which is more important, taking care of the patient rather than being spending your time in the claims form and all. And then claims transition to the peers, posting after validation of the claims request. So there is a good flow chart. You can see services delivered, services documented, services approved for the claim. And the claim generation, if you see, claim batch is created, claim batch file is made by the companies, claim batch report is there, claim scrubbing is there, claims, all the claims are being scrutinized by the companies, insurance companies, and then claims transmitted to the payer. So it directly goes to the payer because he is submitting the claims.
Sir, it's a 9-step process, no?
Yeah, 9 step. Actually, it's a 3 step, but it now here they have divided into three.
Okay. When we start from the service is delivered, and the last one is the claims transmission report.
Right. Until unless you get the claim.
Until unless you get the claim. Payer.
Yeah.
Okay. So payer
Like
means
this,
the insurance company, no?
like this claims. This is done by insurance companies. Yeah.
Okay.
It is like very similar to India, if you say, but very much in the scrutinized way, and they have very much made it automated, like putting diagnosis code and all. So they don't have to take a lot of manual decision. In India, what happens, right? Doctor writes the procedure on their pad and then get it printed, and it goes to the for the submission. So that a lot of things that it get manually, like some of the person sitting at the like Star Health or the Cigna, they are taking the decision by reading reports. Most of the things in US are being automated. Like this is the decision, this is the diagnosis code, and it will be reimbursed or it will not be reimbursed. It's like a binary end system kind of thing.
Okay. So where is our work has come in this 9 step? At the last of the when the report. Yes, our work when will come?
So this is the claims data, right?
Okay,
Once
sir.
this data is with the insurance companies, these insurance companies give this data to the data sets companies, which I told, like Symphony, Flatiron, and all. And then
Okay, sir.
pharmaceutical companies buy that data from those companies and do the analysis, right? To see how it can be, various analysis can be done from this claims data to help that pharmaceutical companies, those products, those therapy areas, to get insights and get into more and more strategy. So
Okay,
this is
sir.
the whole claims data which which resides with the reimbursement company. I'll show you the website if I go. Even Optum has the huge data set.
Later on.
Yeah. Now they say that reimagining the infrastructure of cancer care. So what they are doing, they are taking the data from the insurance company, and specifically they are selling the data of the oncology drugs to the oncology companies, where the most of the analysis can be done. I'll show you in the future slides, right? How what type of analysis can be done from these claims data.
Okay, sir.
So again, it can be recap of the last slide, but it's like steps involved in the medical claim processing, patient registration, patient eligibility verification. So simple steps which are involved in getting admitted and getting claims finally. Now getting into the patient's level analytics. There were two words, right? When you had discussion with Krishna on the data sets. First thing, sales data analytics. So sorry, the marketing data analytics or the sales data analytics, where you had IQVIA data, Midas data, NDTI data, NPA data. You went through the Excel files, you did some reports, you had the top companies and all. So those are the sales data analysis that will give you KPIs like market share, how much market share you are having right now, with what growth rate you are uh, growing in the market, what is the evaluation index, means whether you are going fast or market is growing fast. And then second thing, whether uh, you your competitor is going fast. And then we have data coming in terms of total prescriptions, new prescriptions, refill prescriptions. We have done all this analysis where we saw that, right, what is the amount of new prescription uh, coming into the market, right? It should not happen like only the total prescription I am very good, but the new prescription is going to various other therapy areas or the brands. So that was the sales analytics. And then or we call this marketing analytics. And then sales analytics, we will be covering this module maybe tomorrow or the next week, where we will see within the ecosystem of the pharmaceutical company. I'm saying within the ecosystem. Most of the people who are here in this batch who are from the sales, they can understand within the ecosystem of a pharmaceutical companies, where the medical reps meet the doctors, and there is a whole sales team. A lot of data is generated inside the company, how many doctors you were meeting, right? And how many targeted doctors there, how many non-targeted doctors were there, how many doctors were there who have the real business, how many doctors you are meeting who are not giving the business, but they are the influencers, right? They may be the QL, you may be spending money uh, on them with respect to sending them to big conferences, doing CMEs, because you know that these are the influencers, and they will create a prescription follow up with respect to other doctors who follow them. So first was the marketing and data analytics, where Krishna would have discussed the Midas and DAT and PI. Second is the sales data analytics, which comes into from the within the ecosystem of a pharmaceutical company. Third is the patient level analytics. Now, why this patient level analytics is done? It was not done earlier 10 years back. When I was in the system, right, we were doing only marketing data analytics and sales data analytics. But when these data like insurance companies uh, started taking and they collating and everything, and then companies like Symphony and all started selling this data. So this is another type of analysis which guides you and which helps you to triangulate the data with the other analysis you have done. That this patient level data analytics, claims data and all, it's not all on the complete population of the US, because it's not very easy to get this data for the US population. So it's a projected data, but lots of analysis from this data you do that to see how the patients are moving, what is my patient share. You may be going in market share on like how much my brand is in terms of value and volume, or the NRX, TRX, and RRX. But it is very important to see also how I'm doing in terms of patient share. How many patients I have? Because you may be having a very high drug price, so that's why you may be very good in market share in terms of value, right? Value means in terms of revenues. But patients, you may not be getting new patients, right? So patient share is very important. To calculate the patient share is very important. So all these types of analysis can be done from this patient level data rather than claims data. You can say patient data or the claims data. And these are the jargons, right? Not jargons, but will be asked from you in the interviews, like, do you have worked on the claims data? Do you know about the patient level data? So these things there you have to elaborate and tell the recruiter that you know about the claims data, patient data, from where it is collected, what type of analysis. And this patient level analytics, as I told you, is more and more done for the products which where the in every therapy even patient is important. I'm not saying in some therapies it's modern, not, but in some therapies the patients are very less, like in oncology if you say, or the rare disease you say, where you can track each and every patient.